Texas and the nation is faced with an epidemic of obesity. In my region, 6 states, which are Arkansas, Louisiana, Oklahoma, New Mexico, and Texas, the state obesity rates for all age groups are all near about 30%. As we all know, children who are overweight are more likely to develop diabetes and other chronic disease risk factors. So the inactivity and poor diet that causes at least 300,000 deaths a year in the U.S. also, as Dr. Coe mentioned, is related to diseases that cost the U.S. economy more than $147 billion every year. In Region 6, we have been working locally with mayors and communities who are looking to improve the health of their communities. 3 of these entities, including some of the tribal governments that we work with in this region, have received the Communities Putting Prevention to Work grantees from CDC. The Jemez Pueblo in New Mexico is focused on physical activity and healthy choices for their constituency. The Cherokee Nation in Oklahoma has focused on media strategies to promote healthy food and beverage choices. And one of the entities in Texas, in San Antonio, was highlighted by the Restaurant Association voluntarily changing their menus to be more healthy for their community. Another example of some of the great leadership in our communities includes Mayor Cluck of Arlington, that's in Texas, who provides students with pedometers each summer, and he challenges them to track their physical activity. When they return to school in the fall, the kids with the most recorded steps are recognized for their efforts. They have also improved the menus in the schools to healthier choices, and they are a Let's Move city. In Little Rock, Arkansas, the mayor hosted the first Healthy Food and Active Living Summit that's working to address food deserts, improve access to full grocery stores in the underserved neighborhoods, and to eliminate health disparities, among other things. It was my pleasure to host Secretary Sebelius, and she joined me for that event in Little Rock. And also the city of Brownsville, who is a Let's Move city, created walking paths that have revitalized parts of their city. They engaged the community in the Biggest Loser competition, which was fun for the community, and created an award-winning farmers market, which promotes fresh produce with the use and engagement of local farmers and the use of SNAP, the Supplemental Nutrition Assistance Program funds. 80% of Brownsville is either overweight or obese. The Brownsville School District has been engaged with CATCH, which is the program that we're going to hear about in a few minutes. The science of CATCH is demonstrating that behaviors such as physical inactivity and eating foods in high fat can be challenged and changed. So it's my pleasure right now to introduce to you Dr. Deanna Hoelscher, who's the professor at the University of Texas School of Public Health, and the director of the Michael and Susan Dell Center for Healthy Living, who will speak in more detail about the CATCH program. CATCH stands for Coordinated Approach to Health Science, and it is a coordinated school program that builds an alliance of parents, teachers, child nutrition experts, school staff, and community partners to teach children and their families how to be healthy for a lifetime. So we're pleased to have Dr. Deanna Hoelscher in Texas to help lead this program. Dr. Hoelscher?
I am pleased to be participating in this wonderful webinar series. Today I would like to talk to you about a program on which I have worked during the past 20 years, the Coordinated Approach to Child Health, or CATCH. CATCH is modeled after the CDC's Coordinated School Health Model, which seeks to promote physical activity and healthy food choices through a coordinated effort, in which a child is surrounded by consistent, healthy messages at school and at home. CATCH includes separate programs for classroom teachers, child nutrition service employees, PE teachers, school administrators, and families, as seen in this slide. CATCH is coordinated by a program champion at each school who organizes the CATCH committee along with representatives from the other school components to implement the program, along with support from district-level administration. Classroom curriculum components include behaviorally based curricula for each grade level, from Jump into Health for kindergartners to Breaking Through Barriers for fifth grade students. Materials supporting the other components include activity boxes for the PE teachers, nutritional guidebooks for the cafeteria, and take-home family activities, as well as family fun nights or health fairs that bring the families to the schools to celebrate healthy living. CATCH began as the Child and Adolescent Trial for Cardiovascular Health, which was a research study funded by the National Heart, Lung, and Blood Institute of the National Institutes of Health, or NIH. CATCH was designed to extend the research of the 1980s in cardiovascular disease prevention in youth. The CATCH research project was unique in several ways. First, it used a rigorous research design involving a large number of schools, 96 schools across the 4 sites you see on the map on the slide. Secondly, the intervention included actions at multiple levels and components over 3 years involving 3 separate grade levels. And finally, CATCH was one of the first studies to focus on children from ethnically diverse communities in California, Minnesota, Texas, and Louisiana. The NIH research funds for development and testing of CATCH were leveraged into a robust evidence-based program that has been translated from the bench to the trench. CATCH outcomes and implementation efforts have been continually evaluated and improved since its inception. This slide provides an overview of some of the major outcomes of the CATCH main trial and a few follow-up studies. During the main trial, we found that the CATCH program resulted in reductions in total fat and saturated fat content of school lunches, increased moderate to vigorous physical activity in the students during PE classes, and improvements in self-reported eating and physical activity behaviors of the students. A follow-up study showed that these results were maintained through 8th grade without further intervention efforts. A later replication study in El Paso, Texas, at the University of Texas, El Paso, found that a reduction in child obesity and overweight prevalence in a mostly Hispanic and low-income population as a result of CATCH implementation. Building on these outcomes was research demonstrating the cost-effectiveness of CATCH, with one study reporting CATCH to be the most cost-effective way to prevent obesity in youth. Finally, recent data from our studies indicate that implementing CATCH with 60 minutes a day of physical activity in children can result in significantly higher academic scores on the Stanford Math Assessment. I would like to take a little time now to discuss the impact of CATCH in Texas, where obesity rates in school-age children are higher than currently found in the United States, as you can see in this graphic. Data from the School Physical Activity and Nutrition, or SPAN, study, a surveillance study documenting child obesity rates in Texas at the state and regional levels, is presented on this slide. When these data were shared with the state, they became the catalyst for marking child and adolescent obesity as an immediate priority for intervention for state leaders.